Chapter 6, we're getting into the skeletal system. We'll start first with the axial division of the skeletal system. And our skeleton is subdivided into two main parts. One is the axial skeleton, comprising the skull, vertebral column or backbone, and the thoracic cage or the rib cage, color-coded here in yellow. And then the appendicular skeleton are the bones of the appendages, our arms, our legs, and how they're attached to the axial skeleton, pelvic, and pectoral girdles. So the axial skeleton functions in support and protection of organs in the dorsal and ventral body cavities, for example, the spinal cord, the brain, lungs, heart, liver, etc. Houses are special sense organs for vision, eyes, olfaction, smelling in the nose, hearing in the ears, gustation or taste sensation in the mouth. Also serves as sites for muscle attachments that adjust and move the head, the neck, and the trunk. Also involved in respiratory movements. So when we inhale, breathe in, our rib cages go up and out somewhat, and the sternum, your breastbone, goes forward and up, and that enlarges the thoracic cavity volume, and that helps you inhale, breathe in. When you exhale, the ribs drop down, the sternum drops down, and posteriorly, reducing the volume, and that helps you push air out. And also serves as a stabilizing structure for the appendicular skeleton, which is attached to the axial skeleton. Also site for blood cell formation in the red bone marrow, in the enlarged portions of the bones that have spongy bone within them of the axial skeleton. And we'll see the appendicular skeleton and their epiphyses also serve as sites of blood cell formation. Let's move into the skull. So 22 bones in total, 8 form the cranium, which houses the brain. We have the occipital bone posteriorly, essentially, here in orange. One of them, 2 parietal bones, a right and a left. 1 frontal bone, here in gold. 2 temporal bones in pink. A sphenoid, which we can see in purple, which spans across the skull to the other side. It's a very irregular shaped bone. And then an ethmoid, which we can barely see here in green, buried within the skull. Also fairly irregular shaped. Then the facial bones protect entrances to the respiratory and digestive system. They are the maxillae. We have 2 of them here in orange. A palatine, which is buried deep inside. We cannot see it here. 2 nasal bones in lavender. That's the bridge of your nose. 2 zygomatic bones. That's here in teal. Forms part of your cheek ridge. 2 lacrimal bones in pink, buried right in here, kind of in the medial aspect of the orbit. Inferior nasal conchae, we have 2, and those are buried within the skull. Vomer is also buried within the skull. We can only see these in the mid-sagittal section. And then the mandible, your jawbone. Here's a little exploded view a bit of these cranial bones and facial bones. So sutures are boundaries between bones, or the articulations between these flat bones of the skull. They are immovable joints. They're stationary. The 4 that you need to know for the skull are the lambdoid suture, which is between the occipital and the parietal bones here. Then the sagittal suture is between the parietals, so kind of along the mid-sagittal plane of the skull. We can't see it from this view. The coronal suture here is between the frontal and the parietals. Remember, the coronal planar section, kind of straight up and down here. And then the squamous suture is between the temporal and the parietals, and that's that suture there, squamous suture. So the 4 you need to know for the skull. Posterior view of the skull, here's the occipital bone, this bone here, posterior view. So there's the 2 parietals, and there's the lambdoid suture here. And then since we're looking at the posterior aspect of the skull, we can see the midline area where the sagittal suture is there. Sagittal suture, lambdoid suture. Superior view of the skull from above. Here's where the nose is, back of the head. So there's the sagittal suture and the coronal suture. Sagittal suture, coronal suture. A little bit of the lambdoid sutures visible here. So side view of the skull again, color-coded to help you learn those bones. And as we proceed here, we'll highlight the bones and some of the bone markings or features that you are responsible for lecture, and possibly a couple of more markings for lab. This large opening, the inferior part of the occipital bone, this is looking from below, inferior view. This large opening is the foramen magnum, big magnum, foramen opening or hole. So that's the route, the passageway for the spinal cord to leave the cranial cavity, and then the spinal cord will be then housed within the spinal cavity within the vertebral column, the backbone. There are occipital condyles here articulating kind of bony ridges that articulate with the first cervical vertebra in your neck, like so. So kind of a lateral posterior view. Here's the occipital bone, there's the occipital condyles, and they're articulating with C1, the first cervical vertebra here. Okay, moving on to the frontal bone. Anterior view of the head. Here's the top of the orbits, the eye sockets. Nose would be here, bridge of the nose. So the frontal bone, if you're going to hit a soccer ball, do a header, you would use the frontal bone to impact the ball. Within it, there's the frontal sinus, as you see here, frontal sinuses, or the frontal sinus within the frontal bone, right about here. And that sinus is continuous with the other sinuses and with the nasal passages or nasal cavity. Okay, let's move on to the parietal bones. They articulate with the frontal bone, the sphenoid here just a little bit, temporal bone, and then posteriorly the occipital bone. Also serves as sites for muscle attachment. You do not need to know the details here on the figures. Again, focus on my text part and what I explain based on that. Because as we get through the bones, there's many bone markings, and you actually do not need to know the majority of the bone markings, just some of them. Okay, let's move on to the temporal bone here on the side of the head. It's a little more elaborate, more features, a few things to know here, like that opening, external acoustic meatus here. If you stick your finger in your ear, you're sticking your finger within the external acoustic meatus of your temporal bone. Oh, this all popped out at once. Okay, anyway, so it also forms part of the zygomatic arch, which is your cheek ridge. This portion that moves anteriorly, that's called the zygomatic process of the temporal bone. And it's called the zygomatic process because it moves anteriorly and articulates with the zygomatic bone. But it is the zygomatic process of the temporal bone. Excuse me. It also articulates with the mandible here at the mandibular fossa. As you see, this part, this condyle of the mandible slides right into this fossa and allows a hinge action, allows you to open and close the jaw. It houses the inner ear in here, the structures for hearing, but also balance and equilibrium. Site for muscle attachments as well. Excuse me. So the zygomatic process I talked about. The mastoid process, which is what you see here, the kind of bony bump here. You can actually feel that if you put your thumb, fingers just kind of right behind your ear. You can feel that bony protrusion sticking down inferiorly. That's the mastoid process. It has muscle attachments for some of the muscles that move towards the neck, throat, esophagus area. Let's see, external acoustic or auditory meatus I mentioned. Passageway for sound waves to enter into the ear. The styloid process is this kind of bony protrusion. Well, it is a bony protrusion, this thin one here, and also serves as sites of muscle attachments that go towards the tongue. Styloid process. Mandibular fossa I mentioned. That's this articulation site for the mandible. And then the carotid canal or the carotid foramen, either term is fine. That's the opening for the carotid artery to enter into and serve the brain. And you can only really see this from an inferior view of the temporal bone. Oh, anyway, here's the mastoid process and the styloid process, and it shows you how the muscles attached to parts of the esophagus, larynx, to help support that. So some different views here of the temporal bone. This is a side view, lateral view. Here's the inferior view, and here's the carotid canal, which is exactly inwards, in other words, medial to the styloid process. That's styloid process. You turn the skull upside down, look at it from the inferior view, find that sharp, bony styloid process, and immediately medial, there would be the carotid canal. And that's a passageway for the carotid artery to enter into the cranium and supply blood to the brain. Here's a medial view of the temporal bone. So this would be the right temporal bone, looking at it from inside the brain to the left. Here's the internal acoustic meatus for the innervation that go to the brain for the sense of hearing and balance. What is this here? Oh, mastoid air cells. Forget about that. Okay. So this picture, here's the diagram of it. Same inferior view. There's the styloid process, and there's the carotid canal. And as I mentioned, within the temporal bone, it houses the structures for hearing, the cochlea, and for balance, the semicircular canals. And also the hearing bones, the auditory ossicles. Ossicle refers to bone, as the malleus, the incus, and the stapes, sometimes called the hammer, the anvil, and the stirrup, because it kind of looks like a stirrup on a horse's saddle. And this is the life-size representation of these bones. So this is how big they really are. Malleus, incus, and stapes, the smallest bones in our body. Okay. The sphenoid bone is this weird bone that spans across the skull from the right to the left, kind of deep in there, forms part of the cranial cranium floor, forms posterior part of the orbit, a bit of the face, a little bit. It articulates with many of the cranial and facial bones. It's very irregular shaped. It has this little depression called the sella turcica, which we can see right there. It means saddle, right there. That we can't see from this view. And part of your brain sits right in there, the pituitary gland. Foramen ovale, which we cannot see here, but we'll show it in another view. Passageway for blood vessels. And then the sphenoid sinus. That's a space within the sphenoid bone, sometimes called the sphenoidal sinus.